Okay, we are sitting here with a very special person, Dr. Lori Cardellino.
Nice.
I'm getting good at these names. And we're also sitting here with Mark Daniels, which is a friend of mine of about 35 years, and we've gone through a lot of tribulations, and changes. And I've known you now for how long, Doctor?
Probably 5, 7 years, 6 years.
Okay, so about 6 years. And Dr. Lori has been taking care of my teeth for the last about 2 years now.
Okay. And mine as well. Actually, a little bit more.
Okay, now she's not just a dentist. This woman here is a super dentist. And I'm not just saying that, okay, because she's not just a regular dentist. She's a holistic dentist, which holistic dentists, of course, are not. There's not too many of them around. Okay, so tell us the difference between just a holistic dentist versus, so people even understand, really the difference between just a regular dentist and when they use regular materials and doesn't understand the total body, like we're talking about.
Right. Well, the premise of it is that the mouth is connected to the body. So what you do in the mouth can affect the body. But holistic dentistry in general, for the toxic part of dentistry, is holistic dentistry is based on the foundation that mercury should never be in the human body. It's the most toxic element, and the teeth are not a place to place it or have it. So holistic dentistry is, we do not place mercury fillings, and when they're being removed, you can't just drill them and hope that the mercury isn't going everywhere. When you drill a mercury filling, when you take the drill to it, 5,000 times the legal dose the EPA allows for mercury toxicity happens when you drill a tooth. So you've got to protect the patient and the environment with a thing we call mercury safe removal protocol. And that is, you've got a rubber dam on. The mercury does not go in the mouth. You have to be breathing forced oxygen in your nose because, as you can imagine, when you're going to the dentist, you can't breathe out of your mouth. So you're breathing fast and heavy out of your nose, and you're breathing those mercury vapors at a huge rate. The science of all this is off the charts for, it's the most toxic element on Earth. It shouldn't be in the human body, and when you drill it to remove it from the human body, it's a really big thing, and you have to be careful. So you've got to have the rubber dam on. You've got to have oxygen being forced up. And a very, very large suction has to be here so that you're pulling the mercury vapors away and down and into a mercury vapor canister so that the mercury doesn't go in the environment of the room that you, the patient, the dentist, and dental assistant sitting in.
So this is, you're a detoxification specialist also, not just a dentist, not just fixing problems. You're actually refixing things that someone else already tried to fix a lot of times because of the incompatible materials, sometimes just because of not getting the correct, not procedures done, but the correct protocols on how to really fill the tooth with a bio, what do you call it, compatible.
Yeah, well, that's the other tricky part of dentistry. We sort of can't get out of our own way. Hard plastics, hard enough plastic to chew on, are BPA, bisphenol A plastics. So in dentistry, a lot of the materials that we put in that are composites are also toxic to the body. So holistic dentistry, we use what's called biocompatible materials. The material that's the best, I think, I've been at this for 22 years, I feel the best material on the market right now is a material called Diamond Crown. And it is it's just a crystalline structure as hard as enamel itself, and it's just a great way to fix a tooth. And there's no mercury in it, and there's no toxic BPA carcinogens in it. So, and believe it or not, that's less than one half of 1% of practicing dentists use this material, because dentistry is a profession that thinks it's okay to put mercury in a tooth.
So that's a good point, Dr. Lori. Now, could you explain further or define what a real holistic dentist is? Is that what you just explained a moment ago?
Well, there's a couple parts to it. The mercury, the holistic part of the mercury should not be in the human body, and you should remove them and replace them with biocompatible fillings. The other piece is that this entire thing is all connected. So if you have infection, or if you have other metals, unlike metals, if you have dentistry that is not okay in the human body, if you had an infection in your toe, you wouldn't ignore it. If you had an infected leg bone, you wouldn't ignore it. In dentistry, bleeding gums and infected bone is something that's just accepted. And dentistry often causes that infection, and it needs to be dealt with because it affects the whole body. If you have bone infection, the immune system is really working hard for health. And so holistic is mercury out, no infection. So no metal and no infection in the body, because there isn't any other medical profession that leaves infection or metal in the body. So
No, exactly. And one of the just so everybody can see, I'm the one who's the film person today.
Yes.
All right, give you the aloha there. So one of the departments of terrain modification is dentistry, and that's not usually changed in the beginning, because most people have no idea on who to choose to help them remove the fillings or the root canal or the crown or anything else that's been put into their mouth. And most people, when I do a lecture, most people in the audience, about 95%, have had some type of penetration from the dentist in some form and fashion.
Mm-hmm.
So I know, Dr. Laurie, talk about a person, and Mark can tell you this, a person that is probably the most skilled artisan.
Artist, thank you. That was
Okay.
the word come to my mind, is that I didn't even know you were working on my mouth. After you were done, it was like, what artistry? She
And you
was an
didn't
artist.
even use, just
Yeah.
like I did. We didn't even use any anesthesia, right?
nope, I try
No.
not to.
Zip.
Anesthesia's toxic. I learned that from my
Zip.
mentor.
So if you don't need it, basically.
Yeah, if you
So
don't
Dr.
need it.
Laurie's really good in many different ways. It's really hard just, I'll go this way just for a sec. It's really super hard to find somebody that you feel that knows what they're doing, because a lot of people may have the degree, but it's very hard. Referrals are everything, and this is my I've had quite a few different bouts of sort of assaults with dentists, and she's the best person that I've ever actually had work on me, just because she's not just gentle, she's an artist. She knows what she's doing.
Well, I mean, I love what I do. I didn't even know what dentistry was. Look at my teeth. I have perfect teeth, 32 perfect teeth. So I didn't really know what dentistry was. So in dental school, when I learned what dentistry was, I was like, what? Like that? It can't be. And it's just one of those jobs that you have to be totally engulfed and love what you do, because it's a difficult job and it's a hard job to be honest. Dentistry is all about, if your dentistry fails, the person comes back and gets more dentistry, you make more money.
Yeah,
So-
not only that, remember a lot of dentists, what is it, number one depression of a lot of the different practices from a lot of dentists actually using very toxic materials and not actually even protecting
right.
themselves or the people that are in their office.
It's a toxic job. Number one suicide rate, highest retirement rate, highest cancer rate in dental assistants. Yeah, we
Jeez.
have
That's
all
intense.
them.
No.
Yeah.
I'm not getting into dentistry. Thank you. Thank you, Dr. Laurie.
Yeah.
Well, you're dealing
So-
with basically what you're trying to do is what I want people to do is I want them to terrain modify themselves to an optimal state. And if you don't take out these mercury fillings out
Good
of your
point.
mouth, okay, and if you don't change the terrain of your mouth, then most likely you're wasting your time trying to regenerate, because your nervous system is being assaulted, your immune system's being assaulted massively.
That's the life-changing whoa moment in dentistry is when I personally saw the smoking tooth video. In dentistry,
Oh,
you're
yeah.
taught, you put the mercury in, you condense it down, and 24 hours later it's inert and stable. And you're like, I mean, I had a chemistry major, so I was like, I don't think it's ever stable, but it must get something stable because people don't die as soon as they get one. But when you see the smoking tooth video, that amount of mercury vapor is huge. And if you try to not eat mercury, not eat fish, and you have one mercury filling, you're getting 500 times more mercury 24/7 off that
All the
mercury
time.
filling. 24/7.
And the more you stimulate it, brushing your teeth,
Hot water,
drinking tea, or just even the human body's temperature, you're
Touching
constantly
them.
off-gassing.
touching them.
Really, really quickly, for those of us that are serious about our health or taking it to the next level, what is it about, so we can explain to everybody, what is it about not having this done that is blocking them from taking back their health or taking it to the next level?
It comes down to the detox natural system. The natural system lives in the gut, the heavy metal system, the glutathione pathway. In the gut is where the body pulls out mercury, which is the gatekeeper. That's why it's the most toxic element. If you have mercury in your system, none of the other heavy metals can be detoxed out. So it's shutting down the system that is needed to detox the whole body from heavy metals. And that's the whole, you've got to turn off the faucet before you think you can do chelation, before you can do cleansing, before you can worry about your gut flora. You have to turn off the faucet of the mercury that's leaching out of the amalgam fillings, and it's not a small amount.
And what happens? This is a big point too. See, people have do a switcheroo. People have mercury fillings, okay, and there's off gassing as they breathe. They're blowing this smoke. They can't see, but under a phosphorescent screen, we'll link at the bottom here. You'll be able to see smoking fillings. But you're also swallowing the vapor, and it's destroying your gut wall bacteria. It's destroying the terrain in your gut, which, remember, 85% of your immune system is living in your gut. And if your mouth is perverted, then how could you ever get your intestinal body bacteria, which is everything, brain chemicals, vitamin production, just making you become, just forget optimal, just healthy.
Yeah, and there's even another piece that when you're a dentist and you're a medical trained American dentist and you see things and you're like, whoa. The first time I saw what's called the tooth organ meridian correlation. Lower molars are large intestine. So if you have mercury inside a tooth that's large intestine meridian, there is a direct linear correlation that at least exists. While everybody is in dentistry, we're still debating whether or not mercury is toxic. We're the only humans on Earth debating whether or not the most toxic element on Earth is toxic. It literally is where we are. But when you look at the Eastern medicine and Western medicine, if we are a energy flow of body, and lower molars, those are the teeth where everybody has mercury fillings. They're the ones you get cavities, they're the ones you go to the dentist because of. Having a mercury filling on a large intestine meridian molar is a profound effect on the system. And that's the whole, what's really most big thing we have to do to make that better? Take it out. It takes 5 minutes to remove a mercury filling and put a biocompatible one
and then
in.
there's a whole, of course, protocol once you take it out. How do you deaccumulate everything that you've accumulated from these sort of time-ticking time bombs?
That's why I met Dr. Robert Cassar. I mean, I feel that the answer is always natural. So I think the answer is get rid of the mercury, up your ability for your body to have a healthy gut. That's all the superfood stuff. Mm-hmm. I don't like chelation. I learned from Chris Shade, who is 2 PhDs in mercury. Chelation's a bad idea. And if you're not going to chelate, what are you going to do? Your own natural way the body gets out mercury is the best way to get out mercury. If you don't have mercury fillings and you're healthy, your body will detox mercury. Mm-hmm. And that's the other key point. Why is it still debated whether or not these mercury fillings actually make people sick? Because the human body is so amazing that even when you have mercury in the body's detoxing it out. Yes. So when you shut off the faucet, obviously your body can detox mercury.
Well, what I found out too is, we'll switch around again. What I found out is, if you've had mercury fillings, and I had 14 fillings, but if you have fillings and they're constantly off-gassing, after 10 or 15 years, your immune system, just that alone, forget about the chlorine in your shower, forget about the pesticides, insecticides, herbicides, fungicides, and just generalization, chemtrails, all the assaults, GMOs, everything you can imagine. These are all little pieces that add up to destroying your immune system, which in time gives you a sickness that you will go to a physician or some type of medical practitioner, and most of the time they won't even look at your fillings.
No,
and
they
or
don't.
Your mouth.
This is a chronic exposure over time issue. It's the chronic exposure to the most toxic element every day. It crosses the blood-brain barrier and it crosses the placenta. That's the definition of the most toxic element on Earth. That means the body has no defense. And the other crazier key is not only does it cross the blood-brain barrier, naturally it has ways to get in, there's no natural way for it to come back out. So when it's in, it's in. That's Parkinson's, MS, Alzheimer's, autism in kids. It's the whole,
ALS.
We don't want it to go in. It's really difficult to get it back out because the body doesn't naturally have a way to bring the mercury back out.
So, Lori, explain a little bit more about how having these amalgam fillings block the flow of the meridians. You just started to get into that, and a lot of people don't even know what that is.
The reality of it is I'm not positive because I don't think that that's a scientific thing. Mm-hmm. But we know that the meridian system is positive and negative charge and energy flow. If you put metal in energy flow, it affects the system. It doesn't not. And mercury is a liquid metal at body temperature.
And vaporizes.
And it bonds very easy to carbon, which makes it a methyl mercury. That's the whole, you eat it, you take it in. It bonds to a CH3 group, a methyl group, and now it's methyl mercury. Now it really can go anywhere in the body because now it's not just
And what
elemental.
else is in the fillings? It's not just mercury. It's got a little silver. It's got lead. It's got tin.
Cadmium.
Okay, all
Nickel's
these-
the bad guy. Copper. Wait, get a load of this piece. We added copper about 40 years ago because the copper is the thing that makes it not tarnish, makes it stay shiny.
It gives
As
the gold tooth its gold color because there's only 5% gold in that gold tooth.
But as soon as we added the copper and it made it more shiny, that makes the off-gassing of the mercury 50% more.
You bet.
Because it's a more metallic surface.
So when people have gold teeth, they're not gold because it's too soft.
Yeah, gold's a different conversation, but still blocks the meridian. And gold is only 78% gold. What's the other 22%? Literally, nobody knows. Because that's not the regulated part. So guaranteed, it's the cheapest metal they can find to amalgamate
They
it
have
to make
it
an
harder.
ingot. Yeah.
Just like people
Harder
wearing
and cheap.
jewelry. What
Harder
happens
and
when
cheap.
you wear jewelry like sterling silver? You're wearing sterling silver, which
leaches on.
sounds good, but it's 92.5% pure silver, and the rest of it is a hardener, usually nickel, molybdenum, chromium, and different things like this, like you said, to keep it shinier, not as tarnished as much. So, the assault is not just from the mouth, but if you don't clean up the mouth, trying to clean up the other assaults is sort of a waste of time. If you even go to a lot of the cancer clinics that I know, they won't even take you unless they go to a holistic dentist first, unless you yank out all the root canals.
I'd say 10% of my patients are referrals from Gerson therapy. Because they won't even start Gerson therapy if you have mercury. Because
And
that
why?
was the
Because they feel it's a waste of time.
you can't. You're not gonna be able to fight cancer if you have mercury fillings. It's
Right.
just not
So it's
gonna
blocking
happen.
you from attaining or realizing your optimal health. Now, on this note, what I wanted to get into is that when Lori worked on me the first time, she had to redo what another supposed holistic dentist did and did wrong. When I had mine done back in, I think it was 02 or 01 with Dr. Cassar, they drilled it, but they drilled it out. But I remember I was sick for weeks because they didn't do it right, and I felt like I was in some kind of a haze and stupor. I felt like I was gonna fall on my face.
Oh, my brother, he was sick for about 1 month. My brother Sean.
You should see the science of the amount of mercury that goes in the blood when you get a filling done.
But they did a botched job, and then you had to go ahead and take the rest of it
now
out.
I'm always in defense of dentists because dentistry is a hard job. White fillings are very technique sensitive. They cannot be wet at all. The humidity of your breath can make the white fillings not bond. That's why dentistry still uses mercury. And that's why why doesn't every dentist just start taking out mercury fillings and put white ones in just to make the money? Because
It's hydrophobic.
when you take out the mercury, when you bond in a white one, if it's not chemically sealed, it will leak and it's sensitive and it still hurts. So that whole thing of it's a wet, dirty environment and we have to make it microscopically perfectly clean and dry. And that's why one of the tools I was taught and I use now all the time is ozone. Ozone is the molecule that's going to kill all the bacteria in the tooth before you seed it. And the ozone is going to react to all the H2O and it dries it, it makes it perfectly clean, and then it seals. And a lot of dentists don't even know that that's what they're trying to do. They've never been taught that. They think that just squirting air on it and put the filling in. That's why the white fillings fall out. So
there's a whole different protocol that you learn after you get out of school.
Totally different.
Yeah, just like when I went to school, the same thing. You actually get a degree. You get out of school, it's not that you don't know that much, you've just been taught the traditional ways, and if you want to go through what I would call, that's why I call you a super dentist, you got to start your practice almost all over.
Yeah.
You have to understand what everybody else is doing,
there
but then you have
is
to go to the
not-
next layer.
And there's those that don't like that very much.
That's all about the change, the human condition. We don't want to change. We don't want to admit we were wrong. We don't want to, there's not one procedure that I do that I learned in dental school. Not one. The fillings,
and
extractions,
what
crowns.
you
You went to traditional dental school
Yeah.
that practices or shows the wrong way to do it, and you're coming up the right
It's not
way.
even so much the wrong way. It's just a suboptimal way compared to the way that you've learned right now, because health is not just your concern, it's the total body health.
right.
What I mean by wrong way is that it was the unhealthy way and it was making us sick, and they're saying there's nothing wrong with it, and that kind of upsets me.
It's crazy, too, the part of this story, because every time as a movement we think we're getting headway, something happens. Dr. Oz had a episode on this. And the first segment showed the mercury vapors coming off and him saying mercury is toxic, you got to get them out. The second segment was the head of New York University saying we don't teach to put mercury in anymore. The third segment was saying don't brush and flush your teeth and don't get them out unless you have more than 8, and it was very confusing, and it was one of those.
Backbone.
But the clinical director of NYU, they were like, you went on Dr. Oz and said we don't teach mercury fillings, like you can't do that. And the ADA pulled their credentials. They weren't a dental school anymore, and now they are again back to teaching mercury is the number one choice to put in. Dental schools today teach still that it is the number one choice you should choose when you're filling a hole in a tooth.
And now, we went to school. We know that mercury, fluoride, all these heavy metals, they are severely toxic to the nervous system. Okay, so why would we want to take a chance and put in anything in our mouth next to our supercomputer, our brain? Why would we do that? And not only that, putting phones up to our head, living in electrical magnetic fields.
With the metal.
Okay? I mean, why would we do that? So all we're doing is really, again, we're negotiating the world. Because a lot of the things that are handed down to us, they weren't either by design or maybe they're just by ignorance. I don't know. But all I know is that we know at this time, if you've got amalgam fillings, and those are silver fillings or called mercury fillings, root canals, nickel crowns, porcelain with a nickel base, okay, all these pieces, we know that these are not optimal ways. They may not bother you now, and you may not even be feeling anything at all. But in time, just like why would the cancer clinics are these clinics that are specializing and trying to help people, really help them a holistic way, is because they know if you don't change the mouth, the terrain, how could the gut wall bacteria down here be helped if you're constantly swallowing this poison?
Yeah.
So, Dr. Cardellino, she's in Ventura. And she has people, remember, there's not too many good holistic dentists. You told me you have lots of people flying to see you all over.
Well, that's one of those, it's awesome because I'm so great people fly in to see me. I think that's what's the matter with the situation. I mean, I literally every day drill a hole in the tooth, take out a filling, and put a new filling in. The exact same thing every dentist in America does every day. So the key is, this is a dentist education issue. Dentists need to understand that mercury is toxic. When they drill them, they have to protect the patient, themselves, and the environment. And the key is you have to make it affordable. I get treatment plans all the time from other holistic dentists. I live in Southern California now. And people on the internet, there's 4 or 5 guys that do what I do. So they're price shopping.
Out of hundreds, if not thousands, of dentists.
Well, it's less than half of 1%.
Oh my gosh.
Yeah. There's like
1,000. Specialty.
Yeah, there's 1,000 dentists that sort of go to my continuing ed and do what I do, and we all talk. But there's 150,000 practicing dentists.
Oh my gosh.
So that whole piece of, I get treatment plans all the time that just because they're holistic, and dentistry, you get to define what that even means, but even if we're talking about just mercury safe removal and putting in a biocompatible material, let's define holistic dentistry as just that for this particular conversation. I get treatment plans of $50,000 just because you have a filling, you need to get a $1,200 filling put back in. My thing in dentistry is if you've had a filling for 30 years, there's enough tooth to hold the filling in. So you got to get the filling out, put a filling in. For the exact same price that dentistry is already charging to put a filling in. Dentists are not poor. We get paid a lot to do what we do. So the concept of holistic dentistry becoming this for the rich only, where every filling has to cost $1,200, it's the what I'm trying to do in this whole thing is teach dentists mercury safety, just mercury safe removal, put in a biocompatible filling for the exact same fee that they're getting paid now. Because when you go on the internet as a patient and you try to look for, okay, I get this, I saw the smoking tooth video, I'm not listening to my dentist, I want this mercury out, and you go shopping for a holistic dentist, so the price is literally like
it's out of the chart.
Well,
by far half the price.
And you don't even know who says who's holistic, because a lot of holistic people are just scratching and starting the holistic, or they haven't really.
A lot of times, holistic to the dentist means they don't put mercury fillings in. They don't know mercury safe removal protocol. They're not protecting themselves. They don't. If you Google this, you'll find it. But mercury safe removal protocol. You guys are going to get a link to my website. I wear a gas mask, a mercury. There's only one biohazard mask that takes out mercury, because it's the most toxic element on earth. There's a lot of industries that use mercury. You've got light bulb factories, industries that use mercury. If you drop a vial of mercury when you're in a light bulb facility, because that's where you work, they shut the facility down for 3 days, and the biohazmat guys come in to take up the mercury. That's the same mercury that dentists breathe every day. So my mask is a canister mask this big.
Wow.
And when you go at the patient with
That's
that,
crazy.
they're like, oh my God. It is crazy, but it's even more crazy that any dentist, anybody that goes to work in the dental profession is going to go to work and voluntarily just sit there and breathe mercury all day. I think that's the part that's crazy.
So what you're in holistic dentistry, it's obviously a specialty, but it seemed like we were going into how much more of a premium that most holistic dentists charge for their craft.
Well, there's two parts to it. The first part is they know things that other people don't know, and in our world, that means you get paid more. And the other piece is, as a holistic dentist, you're bringing in people, and the only thing you're doing all day is taking out mercury fillings. So you're breathing more mercury, there's more of a risk, the guys feel like they deserve to be paid more, there's kind of that piece. And the other piece is, once you're the dentist that drills the mercury filling and you create that heat and you sort of open up a can of worms, you may have to retreat the tooth. Something else may happen. You could need a crown. It could break. That whole piece is the whole, we charge more for it because we might have to work harder. But the reality of it is, it's basic dentistry every day in every dental office. Every dentist, every day. Someone comes in with a cavity under a mercury filling, they're getting it drilled out, getting it white and put in. They come in with a broken tooth, they're getting an old mercury filling put out, get a crown put on. It's happening every day in every dental office. The dentists just don't know that they're exposing the patient and themselves to that ridiculously high level of mercury.
That's insane.
And not only, not to say that all dentists, all doctors, and a lot of these different practitioners, no matter where, there are some practitioners that actually are working the patients, giving certain treatments that aren't needed, certain types.
The only thing I'll speak to as far as holistic dentistry goes is, I think one of the main things that every dentist has to rethink is stop drilling enamel. In dentistry, we get this ego of, well, I'll just draw it bigger and put my dentistry and put a perfect filling in it. And holistic dentistry, they tend to be they've got experience, they do big cases, they believe in their dentistry, they drill a lot of good tooth to put a crown or an onlay on. And the tooth held the filling in for 30 years, it just being a filling. So what I see within holistic dentistry, and this affects the cost of holistic dentistry, is it's a filling, do you need a filling? $250, $400. It's a filling, oh, I'm a holistic dentist, so you need a crown or an onlay. That's $1,500. And that whole piece is that, I feel, is a dentist education issue. You have to, as a dentist, change your mind in the dentistry is not as good as tooth itself. And every time you drill healthy tooth to try to get dentistry to work, it's a red flag. Maybe I shouldn't be drilling. You should always be thinking, don't drill enamel. And in dentistry, we're taught you need access, you need to see, open it up so you do good dentistry. We're taught drill the enamel away so you can see better.
Didn't you say that root canals are illegal in your office? Is that what you're doing?
The root canal issue is tough. I mean, in my current world and in my 22 years, I can do videos like this and say mercury is toxic. It's a freedom of speech issue. We've fought the fight. The ADA took out the gag rule. Until 1987, if you said the word mercury as a dentist, you can lose your license.
Right.
Yeah, so the mercury thing is I can do this. The root canal thing is I like keeping it to infected, painful, pussing, bad root canals. They need to be removed because the medical profession agrees bone infection is unhealthy. If you're talking about a clinically acceptable or healthy root canal when you take an x-ray, or the people that do root canals, if you're talking about taking out all root canals, that's a conversation I can't have.
That's a big conversation.
It's just, I can't have it. I'll lose my license.
But you'll notice that a
We'll
lot
table
of
that.
the different facilities that treat incurable sicknesses will not treat those clients, those patients,
I would
unless
say,
they clean up their mouth.
I can say my experience in my patient population. I work on really sick people. I work on sick people that they've had bad dentistry their whole life. They've got end-stage cancers, organs not working, neurological issues that can't be treated by the medical model. So my patient population is very unhealthy.
And how many of those sick people have had atrocious mouths.
All of them.
There
That's
you
why
go.
they're sitting. But that's how they're sitting in the
Well,
dental office.
I
And
just
they were
wanted to say
referred
that.
to you to do what? To clean that mess up.
Yeah. And when they leave me, the only thing they can have is healthy teeth and gums.
That means root canals are out of there.
You can't
So,
have infection.
would it
It's
be
been
fair to say-
scientifically, let me just, this root canal
sorry.
thing, because this I can say. A guy named Hal Huggins, a dear, dear friend of mine, just passed a couple weeks ago. He fought the fight of mercury. And he got MS. He cured himself of MS, realized he got MS because he was a dentist, learned this whole mercury thing. So he spent 30 years being a non-practicing, fight the fight, tell everybody mercury's bad. Once he did that, later in his career, he had a lab in his office. And he had, I think it's 40,000 extracted root canal teeth done by everybody. And he did DNA spectrometry. Is that how you say that one? And he did DNA analysis of the bacteria that live in the tooth. And every single tooth he extracted had 50 to 60 different strains of bacteria living in the tooth that's supposed to be sterilized. And here's the key. Half of the bacteria that live in the tooth of a root canaled dead tooth don't live in the human mouth.
Black, weird molds and a lot of
Molds,
things.
parasites, everything.
So in
If
other
there's
words,
a
it
dead piece
equates
of
to
body,
disease. It
dead
sounds
piece
like.
of body in the body, things will live there, things will migrate there, the immune system can't win. It's not a healthy situation.
So 2
That's
seconds
science.
on there's parasites that also get into these root
Yeah, I
canals
learned that
and
from you.
these-
Yeah, parasites they do what they want.
They get where they can.
Go where
And
they
if there's some
want.
dead tissue in there or some diseased tissue, that's where they say
That's
thank
what.
you for the help.
Imagine what mercury, the mercury fillings that are placed under the gum line, because that's what we do. We put the band on. You get a cavity under the gum line. The mercury's under the gum line. So imagine under the gum line, at the bone level, inside that interface is where anything can live. Parasites, yeast. I have a nasty job, so I won't get nasty, but I do surgeries. So I take teeth out that have been rotten and
stinky.
I
man.
see things like in the mouth that are happening behind the scenes. Like there's no way that can't be affecting the health of the body.
I see dead things.
Man, I swear, I can see live things
You
sometimes.
smell dead things is what you smell.
it's
Rotten
gnarly.
flesh is what it is.
So would it be
gnarly job.
would it be fair to say that you would avoid, if possible, if you could save the tooth, if you could save somebody from having a root canal, that you would avoid it at all costs?
That's almost
is that
always
fair?
if someone on the internet, they'll find, root canals are bad, I don't want one. But you've been to the dentist to say you have no choice. Here's the key that I disagree with dentistry. If a tooth is saying ouch, it's working. It is a functioning nerve. If it's swollen and abscessed, it's dead. The tooth has to be removed. If you're talking about those teeth that the dentist has said we have to take out the nerve because the nerve is saying ouch, that means the nerve is working. You have to figure out why the tooth is saying ouch,
Try to save it.
which is always
save it.
mercury fillings.
So that was my
Yes, you absolutely can save a tooth. If it's chronic pain for weeks and when I chew, it's savable. The nerve is working. You just have to figure out what to do. Dentists don't learn that. Dentists learn the basic check marks.
Cut, burn, close,
No
that kind of
cavity.
stuff, yeah.
It's not a cavity. I just put a filling in. It must be the nerve is dying. I hear that all the time. I get I spent half my day doing second opinions. Well, my dentist said the tooth was dying, so I have to take the nerve out. Cells are either alive or dead. They're not dying. It's alive or
it's
dead.
dead.
And teeth that are dead are abscessed. The body reacts. It swells. It tastes bad. It's bad. Teeth that look perfectly fine and just hurt when you chew, or sweet sensitive or cold sensitive, that's just a nerve that's working.
So, in a nutshell, the reason why you would want to save that tooth and not get a root canal is...
I don't really understand. You never want a root canal.
Well, of course.
You don't
but
ever want a dead tooth.
But the main reason why you want to avoid one, if you possibly can, is because what does a root canal
Each
end up
tooth
doing
is an
to
organ, and if you damage that
You guys are going to make
tooth-
me say this, aren't you?
Yeah.
I gotta.
We're trying to drag it out of you.
The practicing dentist is the key to my work. The science says that. Look at the science. Dead teeth. Name anywhere. Let's do this. Be politically correct. Name anywhere else in the human body that we have a dead piece of body and we leave it there. Your appendix ruptures, you're bad, you're diabetics, your toe goes bad. You can't leave a dead piece of human flesh in the body. And everybody agrees that root canal teeth don't have any nerve or blood supply, so they're dead. So
poison the body.
Especially if they
The
get
next
cavity-
is
layman's
up to
terms.
you to decide.
Especially if they get cavitation.
No, that's fair enough,
Yeah.
Dr. Lori. Fair
mean,
enough.
it's-
I mean, it makes all the sense in the world.
There's
I
a
mean,
great book. Okay, I can do this too. There's a book on Amazon, The Root Canal Cover-Up. The group of fellas that invented root canals, they were German dentist. George Meinig practiced in Ojai his whole life. He worked for Warner Brothers, so he was the first guy doing root canals for the stars of LA. He would go out to Ojai to get root canals. He lived in Ojai, and this goes world. Dr. Cassar's videos go everywhere, but Ojai is very energetic, healing. Everybody is, some of the most amazing healers live in Ojai, California. So that's where he practiced. He invented root canals, him and his buddies. He did root canals for years. After he got older and he realized stuff, and he ended up with the work of Weston A. Price, whole nother conversation. Weston A. Price in 1920 did, all over the place, but the rabbit studies. Weston A. Price in 1920 pulled a tooth the first time, pulled a tooth from a woman, put the tooth in a rabbit. The rabbit got the exact same disease that the patient had. Very famous study. It started the whole maybe root canals. Back then, Weston Price was trying to show and prove the concept of a root canal. Don't do it. But George Meinig, one of the guys that did it. He was the president of the American Endodontic Association. He was the first to teach root canals at UCLA. Like, he was the guy doing root canals. Older he got, more of his patients coming back, things not going well. He wrote the book called The Root Canal Cover-Up. His life. I invented root canals, I was the president, and now I'm here to tell you guys there's maybe another thing we should be looking at. And the book didn't become famous until after he passed. He passed like 3 or 4 years ago.
As usual.
On Amazon, The Root Canal Cover-Up. It's a fabulous book, changed my life. I mean, the acupuncture meridian system, smoking tooth video, root canal cover-up. Everything about dentistry is not quite what
We'll link
dentists
these
think
on the
it is.
videos. Now, to sort of sum up our conversation, the reason why we're talking with Dr. Lori here is because most people, remember, are going to be very confused on what do I do, where do I go, and what do I do, but how do I do? There's all these different questions. So you got to really be smart here and, try not to get into problems with your teeth. Okay, and there's a lot of protocol, as we all know, maintaining your teeth. But if you do have these assaults, then definitely try to figure out what you can do about it. And I'm, doing this interview here is because
It's important.
it's important, but there's very, very few people that I can recommend. Only because I can't recommend people unless I go to them and actually feel the recommendation is worthy. So
Appreciate that.
No, she's excellent. So, and remember, Ventura County, it's about an hour and 20
Hour
minutes
from LA.
From LA,
And I have a
Right.
practice in LA I go down to on Fridays. So
Well,
those that fly in will see me in my LA practice. LAHolisticDentist.com.
outstanding.
Okay, so you're LA and also Ventura.
Yeah.
Okay.
It was, it's easy to see that you're passionate about your craft, and you said something that Robert and I have been saying for years since the inception of Earthshift Products, and you said it yourself. And I just wanted you to touch on why is it that you charge less than your other the other average, I would say average, but the other holistic dentists out there.
The whole thing, the older you get, it's like, what's the big picture? Why am I doing this? This can't be about, filling teeth. This can't be about one thing. To lead this paradigm shift, we got to go with what's happening right now. Every dentist going to work right now charges a fee. We should be taking mercury out safely and putting a non-toxic filling in that model. And nobody was doing that. My mentor was very expensive. He was saving lives, did energy work, all kinds of stuff. He was going to lose his license. This is a general dentist major world environmental issue. 50%, half of all of the mercury that's in the environment comes from the dental profession.
That's right.
We are self-regulated, self-taught, self-governed. That's a bad setup. So for me to prove to my fellow dentists that this is real, I have to do it in their model. So I had to practice for 20 years. I had a baby at 40. He's 10 now. I'm back to work. My thing has now become, I need a general dental model that every dentist can replicate. So I started a nonprofit. I'm building a teaching facility in Ventura. Just one stop. Just come on in, doc. I'll show you how to be mercury safe. Get your AGDA, American Green Dental Association. It's still all in the process. but it's the concept of you got to do it for the fee that dentistry is charging right now for what we do right now. You can't do it for the high fee. That's what's been going on for 20 years. Holistic dentistry is, Hal Huggins was talking about this 10 years before the internet. Since the internet, the public at large knows this issue. Dentists have to be so tired of people coming in and saying, I saw that smoking tooth video, I thought you said mercury wasn't bad. Like, this is a dentist education issue. And for me to have that major effect on an entire world industry, dentistry was started in America. And the world replicates what we've done. So it's a world environmental health issue, and it's definitely a personal health issue. It's got to be affordable, and as it's done now.
And the key thing you said, if health isn't affordable, like we've been saying for years, and the reason why we started our shift, then it's not sustainable.
Yeah.
So you've made it affordable so you can sustain your health. Without it being affordable, it can't be sustainable.
Well,
So that's
and
key.
making things too so they're affordable to me is also being smart with your life. You're going to see people that they're going to want to get their mercury fillings out, but you're going to see people that also just have a cavity and they're going to get the correct materials put in first, because if not, all the people you're seeing to replace, it's like they feel like they've gotten duped. They put all this material inside themselves, and now they're going to the dentist again, to another professional, and they're wondering in their mind, is this what I need, or am I going to have to do this again?
Right.
So, be smart about really picking and choosing, your not just dentist, but any doctor that you go see, any pharmaceutical you're going to need, the food that you eat, the water you shower with and drink, okay, the detergents and soaps that you use to wash your hair and your clothes. These are all little factors of terrain modification.
So many.
Now you've got Dr. Lori here. She can help you. I guarantee you. There's nothing to say.
I can help you.
So, and actually, I have to see you next week because I cracked my little tooth in the back on an olive pit.
Uh-oh.
Yes. So
I'll fix you up.
I will be seeing you next week. And here we go. Give me a hug. Okay.
You are the best mentor ever. This guy knows everything about nutrition. Change your life.
I don't know. The more I know, the less I know. You know how that works.
Yeah.
The more
For
you
sure.
know, the less
Less
you
you
know.
know.
Isn't it so?
Thank you so much.
Okay.
I love you. You're the best.
Thank you for driving out here. And we've been talking about doing this for a while because there's so many people I get all the time. Who do I see? What do I do? I don't know if I can trust another dentist because I already got taken by
Also key too, timing. I now have what's called a CEREC machine. So that's the whole, if I'm doing a big filling and I have to do an on layer, I'm doing a crown. Right now, the key to my work is I have to take out big mercury fillings that dentists won't touch and I can't cause a root canal. So the whole key there is I've got this machine now that I take out the mercury filling, I take a digital video of the prep of the tooth, and a milling machine pops you out a porcelain onlay right there in the office in 16 minutes.
That's pretty
So it gets
incredible.
permanently done. And that's a key point because when you're in the temporary phase, if you do a really deep, big filling and somebody has a temporary for 2 weeks, the temporary comes off or falls off, that could cause a root canal to happen. It could cause a tooth to abscess. So just the idea that finally I have all the technology I had in my other practice. I'm relocated all back in my California niche. And now I got the
that's
tools.
advanced technology.
It is. Yeah, the technology is so far past dentistry. If we could just dentistry and technology, you go to the dentist, the reality of it is you never need the dentist again. Nutrition and good dentistry, you don't need the dentist. That's the key. That is the idea.
Any last words you want to
Nope.
just say?
Okay, one more thing. If you, obviously I can't see every person that's watching this video. So if you want to just email me, give me an idea of, whether or not it's a good person, make sure they're doing mercury safe removal protocol. The worst thing, I get so many patients that get really sick and I've got their referral because they went to a regular dentist and got a bunch of mercury fillings drilled and they get really sick.
And that was
Mark
me.
got really sick. Not from me, from somebody else. So if you're going to get these mercury fillings out, you have to do mercury safe removal protocol. So just be sure that you have a rubber dam on. Here's the key. The dentist has a huge gas mask on, not a mask, but a gas mask. Then they're mercury aware and they know what they're doing.
And there's a protocol afterwards to do because
every dentist is something different. I got you, so.
Yeah, well, once
I'm
you
spoiled.
stop the poison in your mouth, then you have to sort of figure out how do I get rid of some of the stuff I've accumulated in my whole body.
More often than not, the human body's so amazing. When the mercury's out, the faucet's turned off, the glutathione pathway comes back on. Remember, we're new beings in just 30 days. Every new cell is all new. Once you have the mercury out, if you haven't been mercury toxic or mercury poisoned up to this point, so you didn't know your mercury's making you sick, that means you have a good glutathione pathway. That means as soon as the mercury's out, your natural taken out mercury will happen. Behind the scenes, living healthy every day, eat right.
And your gut wall bacteria will finally start to work because they eat up. Look at the tests, the different research they've done with feeding rats methylmercury with a semi-sterilized belly, and ones that have a very strong intestinal bacteria, good one. One of the rats that of course didn't get any of the manipulation to the gut wall bacteria, they only absorbed 1% of the mercury, and the one that got its sterilized or half sterilized gut wall bacteria, it absorbed 99%. So you can see, you got mercury fillings,
major influence.
You got a big problem. You got mercury from your high fructose corn syrup. You've got mercury in
everywhere.
your vaccines. You got mercury in a lot of stuff. Let me tell you.
Green leafy vegetables.
Well, it sounds to me like what we're coming away with here, as long as you have mercury fillings in your mouth, you're obstructing your body's ability to be healthy and to heal itself and regenerate itself. Period.
And then my big picture thing is dentistry has got to just respect mercury as the most toxic element on earth, because you got to remember there's 70 tons of mercury in the human American mouth right now, and that 70 tons of mercury is going to go right out into the environment because we're not regulated. And dental offices, the only thing the dental office needs is a mercury separator. They're $700. You call up your guy, put in a mercury separator.
We're talking insanity
Isn't
here
it
because
insane?
it's the most toxic and lethal substance in the world.
And
we have it in our freaking mouth.
And the
It's like,
fix is the dentist calling and getting a mercury separator for $700.
Yeah.
And it's not done because dentists are not educated on this issue.
Mm-hmm.
One last note. You have mercury and you will suffer more than if you don't have it in the story.
Fact.
The most toxic element.
And never realize the health that you could have had.
Mm-hmm. No good. There we go. All
Thanks,
right,
guys.
There we go. We'll see you next week, Dr. Laurie.
Thank you.
And give the big aloha there, man.
Aloha. I think it's yeah.
There you go. Okay.
See ya.
All right. Adios.
Bye-bye.
Aloha.
Important reminder. All information and ideas are for informational purposes only and are in no way intended as medical advice or as a substitute for medical counseling. Earthshift Products, Dr. Robert Cassar, all of their partners, affiliates, and subsidiaries will not be held accountable for the use or misuse of the information presented therein. This information is not intended as medical advice. The authors, publishers, and speakers of this work are not medical doctors and do not recommend the use of mineral-deficient foods, drugs, or medicines to achieve beauty and to alleviate health challenges. Because there is always some risk involved, all persons involved with the development and distribution of this information are not responsible for any adverse effects or consequences of any kind resulting from the use or misuse of any suggestions or procedures described on our website or Earthshift Live radio talk show or therein.